that had the timelines. It's on D2L, so you can start working on it and playing with it a little bit. We use as a typical cycle 28 days. It varies drastically, female to female, but we have to have a way of talking about this. So we use a typical 28-day cycle to describe the process. So what we're looking at here with the uterus, we're focused right now just on the uterus. Along those 28 days, it's divided into 3 phases. Days 1 through 5, menstrual phase. That's when the woman is having her period. She's actually bleeding during this phase. So remember what we talked about during class today. During menstruation, the stratum functionalis is actually ripped off. So what that will look like under the microscope, broken glands. I'll see just the bottoms of the glands. I won't see the full gland. I also then would say that the surface epithelium should be gone. It's been ripped off. That whole stratum functionalis is gone. So no surface epithelium, broken glands, only the bottom of the gland still intact. And overall, it'll have kind of a messy appearance. You might even be able to see some blood sitting in the lamina propria. You might see some blood cells in there. Okay? So that's the menstrual phase, about days 1 through 5. Well, wouldn't it make sense right after I torn off all of those glands that in the next phase I should rebuild them? Right? You rip them off, then you rebuild them and start all over again. So days 6 through 14 is called the proliferative phase. Pay attention to vocabulary. When something is proliferating, it's dividing. So what we're seeing during the proliferative phase is that basically these glands are rebuilding as they're dividing new epithelial cells. And so because they're brand new glands, they're going to be skinny. They're going to be tiny. They're small. They can be elongated, but they're going to be pretty skinny glands. They're baby glands. They've just been created. So they're not going to have time to kind of grow and puff up yet. So they're pretty skinny glands. The endometrium will be thin compared to the next phase. And I should see a surface epithelium. It's being rebuilt here. So the glands are broken and shed off. Then we rebuild them in the proliferative phase, days 6 through 14. Day 14 is ovulation. Ovulation. Okay, so day 14 of the cycle, that's when the secondary oocyte, stalled in metaphase 2, is released out of the Graafian follicle. So wouldn't it make sense that in terms of the body, after ovulation, the body says, there's an egg available, she's going to get pregnant. And so the body assumes, if there's an egg available, the body gets ready for pregnancy. So release the oocyte at ovulation, and the uterus gets ready. So the final phase, days 14 to 28, is called the secretory phase. In the secretory phase, basically the goal is make the uterine wall full of nutrients, really soft and plush, because the developing embryo is going to burrow into this wall. It's going to implant in the wall. So you want it full of nutrients, really puffy and soft, like a pillow. And so the glands get really thick. They sort of coil up. This lamina propria out here will be full of nutrients. So the overall thickness of the endometrium should increase. A thicker endometrium, thicker glands, puffier, coiled glands in preparation for pregnancy. But of course, most months of a woman's life, she doesn't get pregnant. Okay? So if she doesn't get pregnant, now you've got all this extra tissue. You puffed it up, and it's nice and thick and full. She didn't get pregnant. You don't need all that. So you start all over again with day 1, and the glands slough off. Back to her period. Right? Tear off the glands from the previous month. Rebuild new glands. Puff up the glands for pregnancy. If she doesn't get pregnant, rip them off again. Every month. Does that make sense to everybody? We'll talk about it again, but if I don't sort of explain that, these glands are just